Hello, today I'm going to be walking you through the Complexion Renewal at-home facial treatment. So the first step of this facial treatment is to start off with your GSR. Now GSR stands for Getting Skin Ready, and it consists of your cleanser, your exfoliator, and your toner. Those are very customizable depending on what your skin needs. So if you're drier skin, oily skin, acneic prone, we customize the GSR to your individual needs. For today, I will be using the GSR that fits my needs, which is for oily skin and acneic prone skin. So for my GSR, I'm gonna be starting off with my exfoliating cleanser. And then I'm going to be exfoliating with my dual action scrub, my favorite. And then of course I cannot live without my oil control pads, which is the toner in my GSR protocol. So just keep watching. I'm going to show you how to do those 3 steps. Now that my skin is cleansed, exfoliated, and toned and oil controlled, I will now be applying the second step of the complexion restoration at-home facial treatment, and that is going to be the Enzymatic Peel. So this is a product that we will start carrying it in the office specifically for these at-home facials, just because we know that patients are still wary of coming into the office for treatments. So why not kind of do it at home and do it yourself and get your skin nice and glowy until it's safe to come out for you. So I'm gonna go ahead and take a little bit of this product. I'm gonna take about this much, and I'm gonna apply it all over, massage it in really well. Now you're definitely gonna feel a little bit of a tingling with this, that tingle slash stinging sensation, and that's okay. That's to be expected. Now this product is has a little bit of glycolic acid, but the main ingredients that are doing the exfoliation are the papaya and the pineapple enzymes, which is why it's called the Enzymatic Peel. So I'm just gonna be applying that all over. I'm a little crazy, so I go underneath my eyes. Now, for someone that might have sensitive under eyes, don't do this, but I tend to be a little crazy with myself, so I do. And with this peel, it's actually pretty gentle, so I don't have any irritation that happens underneath the eyes with it. But if it's your first time doing this, I would avoid the eye area. Now, this product also has a little bit of safflower oil, which is a good lipid for your skin. So it will kind of feel slippery when you're applying it and massaging it in. And it's harder to tell when you've penetrated it in all the way. So what I suggest is just to rub it in for a few minutes. You're gonna feel the slipperiness get a little less, and that's how you kind of know that you rubbed it in well. And I like to bring it down my neck too, because you can't have a $1,000 face and a $2 neck. And I also suffer from congestion in my neck area and pigmentation, so I like to take that down there as well to help that exfoliate a little faster, because the neck tends to exfoliate slower. So if you suffer from like breakouts on the neck or like have any pigmentation on the neck, it takes a little longer for that to go away. All right, so now I'm feeling that the slip has really diminished, and now when I rub my fingers over my skin, it starts to drag a little bit, which is what I want. So I know that it's penetrated in very well. Awesome. So that is all for the enzymatic peel. And now, because this at-home facial is for patients who might have a little bit of acne or more like trouble areas, like the neck or the chin, a breakout here and there, I'm gonna spot treat with my Sulfur Masque. Now, this at-home peel treatment, the enzymatic peel, is actually gonna stay on your skin overnight. So go ahead and do this before bed. And then I'm gonna take my Sulfur Masque here, take a little bit of that, and I'm gonna spot treat with that, and I'm also gonna leave that on. So I have a few blemishes here, which blemishes on me lead to hyperpigmentation, which is never nice. So I'm just gonna spot treat. I tend to have an oily chin area. Hormonal breakouts there. Don't have anything over here. I'm kind of just feeling around for right now, but. And then maybe a little bit on the nose too. And if you need to, I mean, you can apply a little bit more. So I'll apply a little bit more on the nose. And that is it for the Complexion Restoration at-home facial. You would do this 3 times a week for best results. You're gonna go to sleep with this on your face, and then you're gonna wake up in the morning and wash everything off, and then apply your Zeo Skin Health daily routine afterwards. It's very important that you use sunscreen, because we did exfoliate a little bit more aggressively than normal, but your skin's gonna look amazing. It's gonna feel nice, smooth. It's gonna look really glowy. Your breakouts are gonna be more manageable, less noticeable, because the Sulfur Masque helps to take away some of the inflammation associated with breakouts, and your oil is going to be controlled as well. So I hope this answered any questions you might have on how to perform this at-home facial treatment. As always, if you have any further questions, feel free to reach out to me at our practice, Lake Nona Ophthalmology Med Spa. Our number is 407-857-3937.